Welcome to SUPERSTAT, the podcast where we break down the big ideas shaping laboratory medicine and healthcare. I'm Melody.
I'm Stephanie.
A.A. Odie.
And today we're diving into a topic that's critical for the future of healthcare: equity in laboratory diagnostics. We're talking about what it means, why it matters, and how it ties directly to value-based care and national health strategies.
Okay, so let's start with the big picture: equity in healthcare. I feel like we've all heard the term a lot, but what does it mean? And in the context of laboratory medicine, so bringing it back home. Equity means that every patient has fair access to testing and diagnostic tools that they need, regardless of where they live, their income, their race, their insurance status. Everyone should have this right.
Right, Erin, but unfortunately that's not always the case. Rural hospitals often have a lack of advanced lab capabilities, and some communities even face long turnaround times for their critical tests. In underserved communities and populations, delayed and inaccurate diagnoses can lead to worse outcomes and even higher costs for the patient and the organization.
100%. And there's some recent, very scary stories about this. So most of them center around labs being bought out or sold off to some esoteric institutions that have resulted in values like troponins and lithiums being delayed from what used to take minutes to hours and sometimes next day. And, when you're talking about an underserved population in areas like maybe rural, like North Carolina, Georgia, parts of the Midwest, this type of consolidation can lead to functional local monopolies where Medicaid and low margin stat testing access suffers.
Yeah, and to kind of piggyback off that a little bit, I kind of feel like, I don't know if you guys have seen where the FTC has kind of flagged a local consolidation that's occurring in California, where we're starting to see competition tighten a little bit more for control over diagnostic services, where we're seeing some of the big 3 or 4 start to pick up more and more of these labs, especially in low-income areas or rural areas, with the pitch of, we can provide the care for less, but what other costs are you paying at the same time?
Yeah, like Melanie noted, the consolidations and the buyouts disproportionately affect underserved and low income and rural or Medicare serving communities. These delays can exacerbate health inequities and undermine the core goals of value-based medicine, which is quality, access, and cost efficiency.
That's right. Even if executives may feel it's necessary for cost, they are seriously putting value-based concerns to the side and trading off what can eventually be a systemic equity failure. So we need to dive in and talk about this. Let's get to it.
Okay, all right. So if patients in certain communities don't have timely access to diagnostic tests, they're more than likely going to be hospitalized, develop complications, or even need more expensive treatments later on. That's not just bad for the patients, but it's costly for an overstressed system already.
Yeah, let's talk about where our government's policies do come in, because over the past few years, we have seen the U.S. agencies like CMS and HHS make equity a strategic priority.
Yeah, the Innovation Center specifically calls out equity as like a key pillar of platform reform. They want value-based models to close gaps in care and reduce disparities. And so that means that all of us, payers, laboratories, providers, we all have a role to play.
Yeah, that's right. As labs, we have the role. Use programs like Accountable Care Organizations, REACH model, and Medicare value-based initiatives emphasize data-driven approaches to identify inequities that we might have not really even seen because we're in the trenches all the time.
Right. So we have to remember, we hold the data.
Yep, we hold it. I'm a huge proponent of this idea that laboratories can exist in complementary function to existing value-based structures. We have a lot of value-based models, but they don't specifically call out labs. And so in a way, by ensuring lab access and being more visible and advocacy, right, we can improve test turnaround times, leverage data analytics, and labs can help health systems actually meet their federal equity goals. And I think there's even a pathway for us to have our own purchasing program that for laboratories where we could succeed financially under value-based contracts by working in complementary function with what's already there.
Okay. So admittedly, can all say we have a long way to go to get to that point. But until then, what can labs do today to advance equity? What do you guys think?
So obviously, one, there has to be an investment in playing our part and understanding that we have a role to play in this solution, right? So reaching out to our multidisciplinary partners, grabbing a seat at the table, and understanding where we can step in and help leverage our footing of the data that we have, of the knowledge that we have to help solve some of these problems. I've seen in healthcare's mobile phlebotomy being a resource. You can use the data that you have in your laboratory to stratify diagnoses or symptoms or CPT codes by zip code, and understand who has more of a disease state or a chronic illness like diabetes in your area, and then target those areas for health fairs, or who is most likely not to visit your phlebotomy draw station and get their labs drawn, and utilize mobile phlebotomy just as a few ways to try to engage your organization in ideas of thinking outside the box to reach out to your community and be at that table as part of the solution.
I love that you kind of brought in that whole investing in your outreach and in those partnerships. That they're key. Making those draw stations and testing more accessible location-wise, because if you have to drive a long way away for testing, then chances are you might wait until you get sick. And thinking outside the box is always a big thing.
And when you're thinking about, sometimes in these communities, it's not just about, socioeconomic issues. Sometimes it's family issues. There's a lot of factors that compound people's inability to be compliant with their healthcare journey. So if you're thinking about, and I know you love this population, Melody, the elderly community or the geriatric community, and if I'm waiting on my adult children to drive me to a doctor's appointment and they have their own challenges with work schedules or childcare, then that can make the situation even more compounded.
Yeah, and what we've actually started doing with our health system, we have health places that they can go for access to if they need radiology services, lab services. It even has a wellness thing where you can actually meet with a nutritionist and a trainer, and they have like a little gym service as well. So kind of a one-stop shop. So that's kind of been something that is a little helpful, so you don't have to go to 20 different places to get the care that you need. So
I like that you gave that example, because what you're doing is you're like assessing your community for access gaps, right?
Mm-hmm.
And you're using data to see where maybe your disparities exist. So like you can look at certain zip codes, for example, and say like, are they waiting longer? Are there differences in test utilization by demographic? In other words, like a rural community, they might not order certain testing because it takes a really long time to get back, but it could be important testing. So when you have those types of environments where you have those stand-up like care areas, considering putting point of care testing in there, or maybe like partnering for some space for like small lab tabletop type things might be beneficial, and you won't know that until you start really seeing and looking at your data and really leveraging that for insight.
Yeah, I think what's important is that we understand, again, that we have an important seat at these tables and we have knowledge that can help to resolve some of these issues. And we've got to think outside the walls of just the traditional clinical laboratory scheme, because it can be a laboratory on wheels,
Mm-hmm.
And overall and long term, us solving these access gaps helps our healthcare communities in the long run.
Yeah, agreed. And then there's even opportunities in local community societies, like if you're doing the American Heart Association in your local chapter, or in Jacksonville, we've got HIV and some other local groups that are to see what their needs are with diagnostic testing wise. So like, are the patients that they're seeing in their communities, do they need more of certain testing or more preventative testing? So I love that you mentioned even with the point of care stand-ups, or even if just education in itself, providing that can be a equity thing as well if they're with those local groups. So being a part of those groups and getting into your community is huge.
I love that you're talking about segmentation, right? So patient segments are a very big part of value-based medicine. Hashtag iChom for learning. I earned that certificate. No, but one of the things, yeah, I went to the program. Plug for the program. But I do think that, and Stephanie did too. I think that, when we talk about understanding the needs of a population, sometimes we think of like 30,000 foot view of population. But there really is something to that segmentation of really isolating the slice of pie and like, what do these individuals really need and what are their shared experiences? Because we're asking what's missing on their patient journey. We try to solve things a lot of times operationally in healthcare without understanding, what they're experiencing and what their perspective actually is. We can't change the fact necessarily that they have HIV, but we can change their experience in healthcare and how they feel calm and comfort. And how their level of capability feels in their daily life and when they're going through our clinics and hospitals. So, yeah, I love that you highlighted that.
Yeah, but even in your own institution too. I mean, a lot of the testing we do, it's nice to have a champion out in a different department. If you realize, okay, you need a better cardiac test, to have someone in cardiology partnering with you because they're even aware of the patients in the community that they're seeing at your own institution. So that could be a chance to innovate, but also provide a little more equity in the testing because they are aware of what their patients are doing, what they can afford, and what they have access to.
Yeah. Cool. And I think policy, I want to just highlight that. Stephanie, you brought that up earlier, but really staying informed about CMS and HHS and kind of where national are like this is unique to the United States, but like where we're going and where they're positioning and what their priorities are, like the AHRQ. Because as a laboratory, if we're going to figure out this value-based medicine piece and like where we intersect and how we can, have maybe even have our own models, we have to know what's going on in the world. And we have to understand, that they have a lot of data too. I mean, sometimes this national data that we're stating or quoting is coming from them. And so understanding what they're seeing on the larger scale can help give you ideas for your respective community.
Mm-hmm. Absolutely.
Yeah. What do you guys think about, like, I know we talked a lot about like equity, like, I guess, across the United States. But what do you think about like equity in the workforce and if that makes a difference in terms of, how we serve our patient population and think about this on a larger scale?
Well, obviously, I think we all know that across healthcare, representation in our communities and diversity matter. It helps you feel like you're an inclusive part of any team when you can see yourself represented not only in your patient population, but across your team members. It helps you feel like a safe, like you have a safe space on your team when you feel like you belong and your ideas are valued because, you see other people who look like you. To me, it helps with our workforce because your patients are able to see a variety of people who match what the community that you're serving also looks like. And I think also it gives you a unique perspective when you can relate to the community that you're serving on that level because you have that connection because there's representation of everybody from the community that they're serving, So if no matter if that is color or race or ethnicity or age or background or the language that you speak, or how you identify, I think it's important that people be able to see themselves and their healthcare providers and vice versa.
Yeah, no, I mean that it's essential. With where I am now, it's probably one of the most inclusive and diverse places I've worked. Where you look around the lab leadership and we're got great representation. We even have members of the laboratory that in some cases a translator for a different language is needed, and the translator isn't there, so a member of the lab team actually can be there for that as well. But you get diverse personalities, and just it's a more, you're right, if your patient can actually see themselves in you, it makes a huge difference. And then just to get all the different perspectives on things can definitely shape any kind of initiative, and makes people feel included.
Well, and it helps when you're creating policy, because policy should be there to support the work you're doing for a patient, right? If you don't understand the patient's perspective, you can create policies that are actually hurting your patient. And so I think about, our friends in the anatomic space who there's sometimes different religions, different beliefs and backgrounds that will require them, if you have an amputation, to do different things with it, bury their limbs. If you have, unfortunately, fetal demise or biopsies removed, and sometimes people want those back for their religious beliefs or just other beliefs that they may have, but what they need to do with those specimens. Sometimes it's helpful to have other individuals working in the laboratory who can understand those backgrounds of beliefs, or at least have some type of cognitive knowledge of where they're coming from. So as you're developing your policies and trying to adhere to some of these things, while you're trying to fit in with regulatory things like CAP and whatever state and local restraints you have, that you can take those things in consideration because they have that patient and that background in mind.
I love that you highlighted the education piece, that we can help each other learn and expand our perspectives, because I can think of a very, very specific situation I had with a young adult whose hemoglobin was like under 4, and they need replacement. They don't need plasma, right? And but she didn't believe in blood transfusion, and it was just a very, very difficult, it was a difficult night for her, but it was a really difficult night for me as someone being on the care team and getting blown up by the physician all night because, he was frustrated with the situation and wanted us to do something as blood bank, and we couldn't do it. You know what I mean? There's nothing I can do. And it just we had someone on our team who really understood it and was like, guys, I just took a moment to really walk us through it and was like, this is their approach and this is what it is. And it kind of lessened a little bit of that stress and anger that I was experiencing because I just didn't understand. And now I can tell other people about that if we run into a similar situation. So I really appreciated in the moment that they didn't just be like, okay, go ahead and vent, but really took the moment to say let me actually help you understand.
I like that too, because I feel like with our patients, we all have a perception of what's best for them and what we can do for them and the best quality of care. But there are those cases where you just aren't seeing the full portion of or the perspection of what the patient needs as a whole. So it's great to have people on your team that can kind of help you empathize and understand. So I love that you highlighted that.
Yeah, and I love that we included equity in our lab cares framework because it functions really as a call to action for the integration of an equity framework into a strategic plan for your laboratory. I think it's really important.
Equity in diagnostics isn't just a moral imperative, it's a strategic advantage. So just like we've been mentioning, when we make testing fair and accessible, we improve our outcomes, we reduce our costs, and we move closer to the promise of value-based care. And in that process, we align with our national strategies that we use to define the future of healthcare.
We had a great chat, guys. I feel like we talked about a lot in SUPERSTAT form. Thank you for joining me with this episode of SUPERSTAT. If you found the conversation valuable, of course you did, don't forget to subscribe, hit those little buttons, share, and leave us a review. Remember, the conversation doesn't end here. So stay tuned for more insights shaping laboratory medicine.
Awesome.